Christy Clement, Oakland County's Chief of Public Health Special Programs. Today I'm joined by one of our epidemiologists, Jared DeValentine. He's going to answer some questions for us about COVID-19 vaccines and masking. Let's start by talking about vaccines. Jared, the virus that causes COVID-19, SARS-CoV-2, has mutated over time, creating the Delta variant. Are the COVID-19 vaccines that are available in the US today still effective against COVID-19?
Yes, absolutely. And thank you for having me on. So research has shown that all three vaccines approved for use in the US, the Johnson & Johnson, Moderna, and Pfizer, are extremely safe and highly effective in preventing COVID-19 infection, and more importantly, preventing severe infection that may result in hospitalization or death. In fact, recent analysis of COVID-19 hospitalizations and deaths found that people who were unvaccinated were more than 10 times likely to be hospitalized or die from COVID-19 as compared to those who are fully vaccinated. For that reason, we highly encourage people who are eligible to get vaccinated against COVID-19. At this time, only people 12 years and older can be vaccinated. That will hopefully change in the near future, with Pfizer asking the FDA for approval for the COVID-19 vaccine for children 5 to 11 years of age.
That's great information, Jared. Thank you. The CDC and FDA recommend that certain people receive a third dose or a booster dose of the COVID-19 vaccine. Can you explain the difference between the third and the booster doses and who can receive them?
Yeah, absolutely. So a third dose is intended for moderately or severely immunocompromised people. If you are moderately or severely immunocompromised and receive the Moderna or Pfizer vaccine, you are eligible for a third dose 28 days after your second dose. This additional dose of an mRNA COVID vaccine is intended to improve immunocompromised persons' immune response to their initial vaccine series. A booster shot, on the other hand, is administered when a person has completed their initial vaccine series and protection against the virus has decreased or waned over time. Booster shots are now recommended for all eligible individuals who have received the Pfizer, Moderna, or Johnson & Johnson vaccine series. So to learn if you are eligible for a booster dose, please visit our website at oaklandcountyvaccine.com.
Thank you for that information. We know that vaccines are one of the tools we can use to prevent illness, hospitalization, and death from COVID-19. Another tool people have been using to prevent the spread are masks. What has research told us about masking up?
Yeah, so through research and infection prevention best practices, we do know that masking is an effective tool we can use to prevent the spread of COVID-19. Masks work by capturing respiratory droplets containing the virus when the wearer breathes out. This blocks them from reaching the outside air and protects others from inhaling them in. Additionally, the masks serve as a barrier to protect the wearer by capturing respiratory droplets containing the virus breathed out by others so that the wearer does not breathe them in themselves. So the mask works effectively both ways. When wearing a mask, you want to make sure that masks completely cover your nose and mouth and that it fits snugly against the side of your face with little to no gaps. Multi-layered cloth masks and surgical masks are appropriate for use. However, the CDC is asking people not to use N95 respirators labeled as surgical or medical, as these are prioritized for healthcare workers. And remember that children under 2 years of age should not wear a mask. Additionally, one of the common myths that we do come across and hear is that masks raise the carbon dioxide level in the air that you breathe. And this is not true. Cloth and surgical masks do not raise the carbon dioxide level in the air that you breathe, as they do not provide an airtight fit across the face, and carbon dioxide molecules are actually small enough to easily pass through mask material. In contrast, respiratory droplets that may contain SARS-CoV-2 are much larger than carbon dioxide, so they cannot pass as easily through a properly designed and properly worn mask.
Got it. So do people need to continue to wear masks in public when they're indoors, even if they're fully vaccinated?
Yes. So at this time, vaccinated individuals should still wear a mask in public indoor spaces, as Oakland County is currently at a high rate of community transmission as defined by the CDC. So this data is available for all to view. It's on the CDC's COVID data tracker by county at covid.cdc.gov/COVID data tracker. And that should also be linked below the video as well. Most vaccinated people do not need to wear a mask in outdoor settings, but if you are at an outdoor gathering or event with a high density of people and a high risk exposure to COVID-19, I would consider wearing a mask in that instance. Additionally, vaccinated people with weakened immune systems still need to continue to take all precautions recommended for unvaccinated people, like wearing a well-fitted mask, as they may not have produced sufficient antibodies to fight against COVID-19 infection after vaccination. That's why it's so important for others to wear masks to help protect our friends, family, and neighbors that may be vulnerable.
Jared, thank you for joining me today. For more information and resources regarding mask efficacy, please visit our website at oakgov.com/COVID and click on the FAQ section. You can find more information on vaccine safety and efficacy on the CDC's website at cdc.gov/vaccines/COVID-19. And these sites will be linked below as well. Our Nurse on Call hotline is available to answer any of your COVID-19 or other health-related questions at 1-800-848-5533. If you are looking to get vaccinated or need a booster or a third dose of COVID-19 vaccine, our vaccine clinics can be found at oaklandcountyvaccine.com. One by one, as our residents get vaccinated, we are closer to ending this pandemic. Thanks for listening and have a great week.